Welcome to my YouTube channel. My name is Wangoi Mwangi and I'm a Kenyan RN. This channel is Nursing with Koi and I discuss matters pertaining nursing and midwifery, owing to my experiences and those of my friends and colleagues that we serve with. If you're new here, please take your time to subscribe and hit the bell icon. Please do subscribe, like, share, comment. Make it as interactive as possible because it is free of charge and it could actually really help somebody. If you're a returning subscriber, please know that I do deeply appreciate you and keep tuning in to Nursing with Koi until we hit the threshold for more and more growth. However, I am really appreciative because we have hit 300 followers and this is our 5.5 months doing this. Almost 6 months because we began on 15th of December last year and we are in June. Actually, it's already 6 months because it's past 15th of June. So thank you so much that within 6 months we have reached the 300 subscriber mark. Let us keep growing, let us keep tuning in, let us keep interacting, and let's dive right in. So today we are going to be discussing about the care of a pregnant lady during pregnancy, that is care during pregnancy. I have 5 main points one needs to remember at all times, and I'll begin with the first without further ado. The first one is eat a balanced diet and have at least 1 extra meal every day, especially if you're expecting, and if they are twins as well. You need to take good care of yourself and have and meet your nutritional needs. In the event you're struggling with nausea, vomiting, constipation, heartburn, those things that may make you not eat properly, again, seek health care advice from your medical provider or your hospital of choice and get that sorted out because nutrition will be needed for the developing babies and yourself to sustain them. Number 2 is using an insecticide-treated bednet, ITN. This is to prevent malaria, and since we know Kenya is in the endemic malaria zone, it is important that you do that. Another point is ensure you take more rest and ensure you're not overexerting because you need to reserve your energy as you're already in the process of making a baby. Number 3, I know I had mentioned this one in my number 1, but it is important for me to put it here for emphasis. Take your iron folate supplement tablets that you are going to be provided in the government of Kenya facilities, in the MOH facilities, from dispensary all the way to national referral hospitals. You're going to get IFAS and will be provided free of charge, and even where it is charged, I think it's below 20 or below 50, basically below $1, which is 100 bob. So, but most importantly, take them religiously as much as you can because they are good for you and they are meant to prevent deformities in your child, especially folic. Folic acid prevents a condition called spina bifida, which is where a baby is born in an incomplete spinal cord, and this can be a very emotionally draining condition if your child is suffering from this. But then anyway, to avoid those spinal defects or neural defects, again, take folic acid as much as you can as prescribed to ensure that you have a healthy baby developing. Point number 5, these are the heavy 5 points that I need you to remember, even if you forget everything else I've covered in the midwifery series. Point number 5 is that immediately you learn that you're expecting, go to your healthcare provider, go to your dispensary, go to your health center, go to your sub-county, county hospitals, the hospital closest to you, and begin your clinic. These stories of where women say you are going to go for too many times too long, it is okay even if you go 100 times because you're better safe than sorry. I will never forget situations where if a lady had presented earlier, they could have been saved or the baby could have been saved, but since they did not attend any clinic, they put their life at risk unnecessarily. So it is important especially to go to the clinics because most of the time they are going to monitor the most important aspects and rule out any complications of that pregnancy when you present to the hospital. With the focused antenatal care, the visits were reduced to 4, but 4 very good visits. In the first visit, almost everything will be done during this visit. You're going to be counseled, you're going to do your individualized birth plan, you're going to get your first tetanus toxoid injection if you are at that point where it is given. If you're at a point where deworming can be done, it's going to be done. Your weight, your height will be taken. You will start taking IFAS because it will be provided. If there is any complications at that point, it will be noted and treated and referred if the facility doesn't have the facilities for that specific service. And then in the event that you have history of bad obstetric history, that means you have lost a few pregnancies, at least you've lost one pregnancy, you will or you may be referred to the high risk clinic where a qualified obstetrician or gynecologist will be reviewing you more closely, and your clinics will be closer together. Because I remember my pregnancy at some point I used to go to the clinic every 2 weeks. I did not tire because at some point I even graduated to once every week. Those visits, yes, they really do help, and where there is a problem, it is taken care of way in advance and prevents loss of life at all costs. So now that we have known the 5 important things or points to do while you're expecting or of care during pregnancy, it is important to note that during your very first visit, why I said it will carry most of your things is because this is where your antenatal profile is going to be taken. And the antenatal profile can be done from hospitals from level 2 all the way to level 6. The most important tests to be done at this point include the HB to see how your blood levels are, and if you're given the IFAS to supplement or you are told to get admitted for a transfusion, is probably because your HB is too low for safe pregnancy. However, because I had talked earlier in my last video about the physiological changes during pregnancy, remember I talked about physiological anemia, which happens because of hemodilution by the excess plasma that is produced that comes with the pregnancy. So if it is the physiological one, basically all you need is the IFAS to support and a good balanced diet. However, in the event that your HB is below 6, you will be admitted in a hospital and transfusion will happen, because that is too low for someone who is expecting or carrying life in them. Number 2 of the tests that will be done is blood grouping and rhesus. So if there is a problem, if your blood rhesus is negative and the husband or the father of the child is positive, because there's something that could happen that is called rhesus incompatibility that could lead to the death of the child, and it is important to know this early in advance because there is treatment for that. In the event you already know your blood group, and it is blood group A negative, B negative, O negative, those negative ones, AB negative, all those ones will put the baby at risk if the husband or the spouse of that partner is rhesus positive. And therefore this, if known in advance, again can save your baby's life and for future babies. So there is anti-D, is a treatment that is given, and it's a serum that is prepared and it's given 28 weeks into the pregnancy. Sometimes it will be given again at 34 weeks and repeated again within 72 hours of delivery. However, if the mom presents too late and it's already at delivery, then it will be given within 72 hours of delivery. In the event that this condition had been diagnosed and this woman has already lost a pregnancy, it means that the mother already has a sensitized body system, meaning when the baby starts forming, they are going to be identified and picked as they're going to reject the mother somehow. I'm trying to explain the incompatibility. There will be the incompatibility, and this incompatibility could lead to the death of that baby. So it is important for that test to be done. Test number 3 that is done is serology, and this usually there are 2 tests that are very important. One is called VDRL, the other one is called RPR. So VDRL, these are the tests that actually says if you have syphilis or not, because among all the sexually transmitted infection, syphilis and HIV are the commonest that cross the placental barrier, which means your baby could be born with neonatal syphilis, and that is not something you want to pass on to your baby. So in the event that you have syphilis in pregnancy, then it will be treated. Among the major causes of early spontaneous abortions are these infections that are called torches. Torches are those infections that are able to cross the placental barrier and go to the baby's side. And syphilis is on that S, the very last S. So this rules out the torches. Then number 4, we have TB screening. It is important, especially if the mother has symptoms of TB, to be screened for TB, and if found to be having TB, then get treatment so as to prevent the baby from getting TB once they get here. And remember, the treatment for TB is quite long term. It could take between 6 to 8 months, and therefore it is important to be very safe. Then HIV, of course, because this is another sexually transmitted infection that crosses the placental barrier, reaching the baby, and therefore you need to get tested. For this one, it is important to get tested with your partner, because you're not in this alone. You did this with someone, but if they are not available, again, that is okay. You just get tested, and if you're positive, you will be given treatment to prevent vertical transmission of HIV. Vertical transmission of HIV is also called mother-to-child transmission. You will continue with treatment until the point of delivery. After delivery, your child will be put on prophylactic treatment to prevent them from actually getting the disease. It is possible for you to give birth to a HIV negative child even when having HIV. So that is important to note. The last 2 tests I almost forgot. We have urinalysis and we have blood sample or blood slide for malaria parasites. So malaria could be fatal in pregnancy. It is important to ensure that a pregnant mother will not suffer malaria at all costs, and that's why we spoke about the ITNs, or the insecticide-treated nets. And then when it comes to urinalysis, it is important to rule out infections, because infections are bad during pregnancy, could lead to spontaneous abortion as well. Go with the tetanus toxoid. However you may think it is useless, it is very, very powerful. Another thing is that the tetanus toxoid has from tetanus toxoid 1 to tetanus toxoid 5. That is the schedule that we have. So if it's your very first pregnancy, you're going to get number 1 and number 2. So, and this is usually 4 weeks apart from the 16 to 18 weeks of gestation all the way. Once you get that, you get immunity for the next 3 years. So if your next pregnancy is within those 3 years, you will only get 1 tetanus toxoid, and this will be TT3, and that will be period for that pregnancy. If the subsequent pregnancy after the second one will be within the next 3 years, again, you're going to get only 1 jab, which is tetanus toxoid 4. Again, if you get pregnant with your 4th child and it is within the 3 years, you will get tetanus toxoid number 5. So up to the 5th one, it gives you coverage for the next 20 years. So not unless you conceive anywhere after the 20-year mark, then again you restart the tetanus toxoids. However, once you do the 5, you have immunity for the next 20 years, which is good, and it will be transferred to your babies over and over. That is one measure, or one preventative measure of care during pregnancy. Measure number 2, we have malaria prophylaxis. And this was removed from the entire country and left in some areas where malaria is endemic. And this is where we used to get, in the past we used to get, I think, Fancida. These drugs keeps on changing. So, but they are going to give you a drug to swallow just to prevent malaria or to treat it if it is there. So it is given prophylactically to prevent you from catching malaria or treating the malaria that you may already have. So there is malaria prophylaxis IPT1, IPT2, and IPT3. Then we have preventative measure number 3 is iron and folic tablets or supplements. This I had spoken about. I'm not going to emphasize further. And then preventative measure 4, we have deworming. I had mentioned deworming as well, because you do not want to be having these infestations of whatever worm it could be. The hookworms are particularly very dangerous because they are going to leave you anemic. And remember, we cannot have anemia in pregnancy because we want to keep the mother safe and the baby growing well. And finally, of the preventative measures again is the insecticide-treated nets. So for areas where the IPT was removed, we were left with the ITNs. So use those ITNs. And for those people who use those nets to rear doves and to do farming in the farm, and you do not have a bed net that works in your home, may God see you, because that net was provided to keep you safe, to keep your baby safe. Please do not use it for farming. Please do not put it under the bed. Do not put it in the store. Just lala ndani, sisi ndani, mbu nje, so that we do not get malaria. It has killed people. And not so many years ago, I think 4 years ago, a nurse friend of mine passed away because she was expecting and had malaria. So you do not want to have malaria in pregnancy.